congratulations for Narayana Health SRCC Children's Hospital, Mumbai. Thank you all for joining us here at Gallup's Mahalakshmi Racecourse as Narayana Health SRCC Children's Hospital shares a moment we are genuinely proud of. A conversation that doesn't get spoken enough in India. Epilepsy in children. And what happens when the right treatment reaches a child at the right time? The epilepsy program at Narayana Health SRCC Children's Hospital was started by a dedicated team of doctors, Dr. Anaita Udvarya Hegde, Head Neurosciences Department, Dr. Pragna Gadgil, Senior Consultant Pediatric Neurology, and Dr. Saurabh Samantrai, Senior Consultant Pediatric Neurosurgery, with a vision to build quaternary pediatric neurology subspecialties in India. Today we are here to share that vision and what it has led. Narayana Health SRCC Children's Hospital has now crossed 175 plus pediatric epilepsy surgeries and counting, making this India's only dedicated and largest program for drug-resistant epilepsy in children. But beyond that number, what we really want to leave with you today are the stories behind it. Children who couldn't read, couldn't walk, couldn't speak, and are all doing that today. Over the couple of years, you will hear from all of the doctors who have led this program and the families who have lived through it. So let's get this press conference started. To open this morning's proceedings and set the context for the brand and the unit, I'd like to invite Mr. Balvinder Walia, Director of Narayana Health Jaipur Unit and Narayana Health SRCC Children's Hospital, to share a few opening remarks.
Thank you very much, Delia. Very good morning to all the media friends, esteemed guests, my team of doctors for this press conference. So my name is Balvinder Walia. I look after two hospitals of Narayana Health. So one is Jaipur, which is a multi-speciality hospital, and one of its kind and one of the best hospitals in pediatric super specialized care, that is SRCC, Narayana Children's Hospital, Mumbai. So for over 2 decades, Narayana Health has been committed to making advanced, high-quality healthcare affordable across masses in the country. And not just in India, we have now a global footprint. We are present in certain countries like UK and the Caribbean. Narayana Health SRCC Children's Hospital, which we are talking about, we are representing today here, has been an important part of this journey, building specialized pediatric care across various centers of excellence. Now, neurosciences is one such area where conditions like drug-resistant epilepsy, they are in children continue to be widely, misunderstood and unfortunately undertreated also. Over the last 3.5 years, to be precise, our dedicated pediatric epilepsy team and the program has grown in India as one of the largest of its kind. So the achievement is not just about numbers. We are not talking here just about numbers. It represents what is possible when children with complex epilepsy are evaluated and treated through a focused multidisciplinary approach, particularly those kids where medicines alone are not helping. For these children and families, you would all agree and acknowledge that every seizure which the child has can have a significant impact on their life, the education, the quality of life, and for the whole family. So our endeavor therefore has been to bring together the right expertise, technology, and a great clinical team to give these children the best possible chance for a better future. I am very pleased to host you, all of you today here, and we would request you to help carry this message across masses so that many kids who are dealing, and many families who are dealing with this issue, they are aware about it, and they have a center and a hope and a team which has already treated many of these kids successfully. So thank you again. I will now hand it over back to Flavia and then to our star team, who has led us in this remarkable journey which we want to talk about. Thank you very much again for being here and for your time. I am truly privileged to stand before you and be a part of this press conference. Thank you.
Thank you for that, sir. And with that context set, let's move into the heart of today's conversation. It is now my privilege to invite Dr. Anita Udvadia-Hegde, the head of Pediatric Neurosciences Department at the Narayana Health SRCC Children's Hospital, Mumbai, to say a few words. Over to you. All of you for coming here to be with us. As the head of Department of Neurosciences, it's been my dream over the years to build up a super specialty department. These were facilities and benefits that the adult population have been getting for so long, and I think it's time that the pediatric population get the benefit of all these super services, cutting-edge science, which hopefully now will become part of everyday life. The SRCC Children's Hospital, managed by Narayana, is really the perfect setup or the perfect center for something of a super specialty frame. We have the infrastructure, we have multiple super specialities, all under one roof. The agenda is so that the child should get the benefit of a holistic care as against just one single condition. Being in the institute since its inception, which was in 2017, the Department of Neurosciences has grown considerably. So we have epilepsy surgery, movement disorders, cerebral palsy, neurodevelopmental disorders, genetics, metabolics, and trust me, we have a specialist for each of these specialties in the Department of the Neurosciences. Coming to epilepsy now. So basically epilepsy would be maybe the single most or the second most after developmental disorders, conditions that we see in the Department of Neurology. Okay, so this, given that the incidence of our population, given the incidence of our country is roughly about 1.5 billion people, 30%, and we contribute about 19% of the world's population. 30% of these fall into the less than 30 age group, or in the pediatric to the young adolescent age group, in the 0 to 19 age group. So we are looking at roughly 50 million people in our country alone. Okay, sorry, So roughly we are looking at about 50 million people alone in our country in the 0 to 19 age group. The prevalence of epilepsy is about 8 per 1,000, and the incidence is about 58 per 100,000 on an annual basis. We are roughly looking at 4 million children in our country alone. When I say children and adolescents in India, in our country, who have epilepsy. You will hear as the time goes by in the course of today that about 30 to 35% of these children have what you call intractable or refractory epilepsy. The others usually get treated by medications a lot more easily, but 30% to 40% may have refractory epilepsy. So we are looking at 1 to 1.5 million children in our country who are potential candidates for epilepsy surgery program.
That's not a small number. The important part I want to also highlight to you that 80% of brain growth happens in the first 5 years of life. 80% of neuronal circuits are laid down in your brain in the first 5 years of life before any of us even know how we are looking after our kids and bringing them up. So if you can intervene in crucial ages, which is the young age, you can make a world of a difference, not just to the child's family, the future, as well as its entire development over the next few decades. But at the end of the day, this is not just neurosciences. Okay, it would be wrong of me to stand here and not be able to thank everybody. We are a team, and you can only work when you work collectively together. So while we may have super specialists in one space or the other, we have such super specialists in all spaces. And it's only when all of us put our hands together, we have anesthesia, we have development, we have psychology, we have radiology, we have neurophysiology. This is just to name those who are in the epilepsy surgery program, forget everything else. So collectively, the agenda is a one-point agenda. We want to see what we can do to make the life of the child and their family better. Thank you.